Welcome back to 570 News. Imagine going in for surgery on one body part and realizing another body part had been operated on. That's what happened to a female patient after a Montreal surgeon operated on her big toes instead of her baby toes. John Robert Sutton pleaded guilty to the 2012 incident and was suspended for 1 month. The patient's lawyer had asked for 3 months, but it was determined that would affect patient wait times, as he sees about 20 people a day. He realized the mistake a week later and said it was possible he read the schedule instead of the consent form. It should also be noted that this was his first infraction in 40 years. Duncan Embury joins us now to share his expertise in medical malpractice suits and explains just how often these things happen. Thanks so much for doing this, Duncan. How are you?
I'm good, thanks. And yourself?
I'm doing very well. This has been getting a lot of traction now, mainly because people are talking about the 1 month suspension. I think that's kind of what's been at the center of the controversy, if you want to call it that. Look, the bottom line is this doctor, this surgeon, operated on the wrong body part. And I've been seeing comments, Duncan, like, oh, who cares? It's just your toes. People should care, shouldn't they?
I think they should care, and I think it raises a larger issue because, of course, it may not always be the toes.
Right. How often does this happen?
Well, I don't know that anyone keeps accurate statistics of how often, a surgery on the wrong body part happens, but presumably it's often enough that there's certainly some move to change it. In about 2010, a lot of hospitals in Ontario, anyway, came up with a surgical safety checklist to prevent this very thing from happening.
Right. And in this particular case, he said that he may have read the schedule wrong, and that has a lot of people scratching their heads as well. And there was also a comment made that I found very interesting, and I guess that was after the court case. But the comment was, well, the surgery also happened very early in the morning, and I'm not sure how that's relevant to the case. Did you see that comment?
I did see that comment, and frankly, I would agree with you. I'm not sure how the time of day of the surgery should affect whether or not it's done properly and on the right body part.
Mm-hmm. Now, there was nothing malicious about this, though, right? I mean, this was a kind of I don't know what you call it, chalk it up to an honest mistake type of thing. You read the schedule wrong?
Yeah, I certainly would, from everything I've read, I don't think anyone would suggest there's anything malicious about it. I mean, you've got a doctor who's been practicing for 40 years and doing it presumably very well. Again, I think it comes really back to the need to have and to properly use a surgical safety checklist. And
so what does that checklist entail?
Well, what the checklist entails, and it came out of an urging from the World Health Organization in 2009, it has kind of three parts. There's a preoperative part, an operative part, and a postoperative part. And for the purposes of this discussion, I think really the key is the preoperative part. What it requires is that the surgery be checked with the patient before, on the morning of surgery or the day of surgery before the procedure started. And what that does, or what it should do, is make sure that the schedule and the consent and the procedure all line up to be the same thing.
Right. That way, and by the way, what that also does, I think, is that you still make sure that the person wants to do it, right? Like that there are no second thoughts, right? It's like a very last, okay, so this is what we're doing.
Yeah, I think that's also right, because you're talking to them at that point, presumably, about the consent as well. And if there's any issues at that point, they're going to come to the fore.
What do you find the reaction has been like in this particular case? I mean, again, I find that everybody's talking about the 1 month. Some people are saying, well, 1 month, what does that do? Other people are saying shouldn't have been suspended at all, that maybe a fine would have been acceptable. I mean, what have you been seeing in terms of how people are reacting to this?
Well, I mean, certainly the reaction that I've read about, it seems like that's the issue that's caught the public's attention. I think what certainly catches lawyers' attention who practice in this area, and probably doctors' attention as well, is, it underlines the need to make sure that we are properly using a surgical safety checklist, because otherwise, this is a human system and mistakes can happen.
And the next time, it might not be toes, it might be something else, and then you start running into real problems. In terms of the 1 month suspension, do you think that in this particular case that was the right call?
That's a hard question to comment on. I don't think that the length of suspension is going to change the likelihood of it happening again. I mean, presumably, this surgeon, I have no doubt, feels very bad about the mistake that occurred, and presumably it wouldn't happen again regardless of whether suspended or not. So I think to suspend for longer may not really do any public service.
Right. We're on the line with Duncan Embury. He is sharing his expertise in medical malpractice suits with us after a surgeon in Montreal, John Robert Sutton, pleaded guilty to a 2012 incident. And he was suspended for a month, ended up operating on the wrong body part. So, I mean, in terms of how often these things happen, I mean, you said nobody really keeps track of this. But what about his clients? When something like this happens, what do clients typically seek out?
In terms of his patients, you mean?
Yeah, no, in terms of people that have had this happen to them, what are they usually looking for afterwards?
Well, I think it really depends on how the mistake may have affected them. And as you rightly say, where this, it can involve toes, it can involve any body part, and it can cause a serious adverse event to people. And in those circumstances, often they do proceed with lawsuits because they require some care as a result of what's happened.
Mm-hmm. What constitutes, on a whole, medical malpractice?
Well, the simplest definition is where the medical treatment provided falls below the reasonable standard of care to be expected of a doctor in similar circumstances and with similar training.
Mm-hmm. All right. Well, you know what? I think it's. Does this set any kind of precedent at all? I mean, a 1 month suspension. Do you think that does anything in terms of a precedent?
No, I think to the extent it sets a precedent, I think what it does is draws attention again to the importance of proper checklists. I mean, when we talk about airline incidents, the airline industry has come up with a checklist to govern pretty well everything that happens in the air, and the reason is to make sure that the frailties of a human system don't cause adverse outcome. And I think the same needs to be hammered home more in the medical profession.
Yeah, I mean, and you mentioned we clearly have that. We have this checklist that you talked about. So, I mean, the conversation then eventually, turns into whether or not the suspension, the 1 month suspension, should it have been more? Should it have been less? Should a fine been okay? If somebody, and what also I find interesting is that during, I guess, the court case, the doctor had said that he doesn't remember how the whole thing went down. I mean, can I ask you to kind of give me your opinion on that? What do you make of that? I mean, he said that he doesn't remember how it all happened.
Well, I mean, I'm not sure. We're talking about an incident now that happened in 2012, of course, and I'm not sure what the passage of time was by the time it got to court or wherever it got to. And so it's certainly not unreasonable that people's memories do fade. And when you're dealing with a surgeon who has a busy practice, they may not remember exactly where they read the information before they went into the operating room.
Mm-hmm. Well, it's a very interesting case, Duncan, and I thank you so much for your time. Appreciate this.
My pleasure, Eric.